welcome to the School of Speech podcast, presented by SpeechTherapyPD.com. School of Speech is designed specifically for the school-based SLP to come together to discuss current topics, tackle difficult situations, and share our insights. Our goal is to bolster confidence, celebrate our triumphs, and foster a community dedicated to the excellence in the school setting. Everyone, and welcome. I'm Carolyn Dolby, and I am your SpeechTherapyPD.com podcast, a host for School of Speech. School of Speech has been designed for the school-based clinician to come together. We're going to explore current trends, share our insights, and really champion our expertise. Our goal is to bolster our confidence, celebrate our triumphs, and foster a community dedicated to the excellence in the school setting. Today's episode is Working with Teachers for Classroom-Based Service Delivery. We are so lucky to have Tiffany Pierangelo here to walk us through working with teachers as we dive into the world of collaboration for school-based clinicians. Today, you will be provided tools and techniques that you can use to support your students in the classroom to maximize outcomes. I'm glad you're here with us because we're going to explore differentiating and defining disorders, navigating difficult conversations, and discovering service delivery options in the classroom-based support model. I do need to start with some financial disclosures. Tiffany receives a salary as the speech therapist and AAC consultant for Los Angeles Unified School District. She's an adjunct professor at California State University, Northridge, and she is receiving an honorarium for this presentation from SpeechTherapyPD.com. Non-financial, Tiffany is a member of ASHA's Special Interest Group 12, that's Augmentative and Alternative Communication. For me, I receive a salary as the district level dysphagia support clinician for Cy-Fair Independent School District. I'm compensated for my graduate course I teach at the University of Houston, and I'm a consultant for school districts across the nation supporting their program development and staff training. I do receive compensation from SpeechTherapyPD.com for hosting School of Speech. Non-financial, I am a member of Texas Speech and Hearing Feeding and Swallowing Task Force. I'm a volunteer for Feeding Matters, and I am a member of ASHA's Special Interest Group 13, Swallowing and Swallowing Disorders, as well as SIG 16, School-Based Issues. Now, without further ado, I want to welcome our guest, Tiffany Pierangelo. Hi, Tiffany. How are you?
Hi, Carolyn.
Yay.
I'm good.
Oh, sorry. Let me tell you a little bit about Tiffany. She is from Southern California. She's a speech language pathologist who is passionate about educating clinicians and parents on how to best support students with speech and language. She currently works with children and young adults in the school setting as the AAC consultant and SLP. She received her BA in Communication Sciences and Disorders and an MA in Speech Language Pathology from Wayne State University. She was a guest on the podcast Speechy Side Up, where she focused on the role of AAC consultants played in supporting SLPs within large school districts. So you can go hear that one after this too. She's an adjunct professor at California State University, Northridge. Tiffany has presented at Talking AAC in 2022, ASHA Schools Connect in 2023, and Closing the Gap in 2023. Welcome, Tiffany. How are you?
I'm good. Thank you so much for having me.
Oh, we are lucky. We're the lucky ones. So excited. I want to jump right in because let's get this party started with discussing what we're here to discuss today. Do you want to start by kind of giving us some background on the different integrated classroom support models? Maybe we could start there. Get us started.
Yeah, of course. So there are 6 different ones that are outlined on ASHA. So there's the supportive co-teaching model, complementary co-teaching, station teaching, parallel co-teaching, team co-teaching, and supplemental teaching, sorry. So there are quite a few, and I don't always like think down to the nitty-gritty when I'm deciding which one to go with. I'm not labeling them at my school, but for supportive co-teaching, you partner together with the teacher as co-teachers. So one takes the lead while the other moves around the class to provide prompts and redirection or direct support, and then you switch. So you're not always being one or the other. For complementary co-teaching, you co-teach during the whole group instruction. So one person enhances the instruction and the other co-teacher provides visuals and examples, paraphrasing and modeling. Then station teaching is just what it sounds like. We know our little ones with our little stations, and you go to a station and the little ones come to you, which that one I feel like is the easiest one if you're getting into it, like to fight off and you're like, okay, I know what this is. Because lots of people in those little classrooms have seen them, the little station teaching section. So then there's team co-teaching. So the SLP and the classroom teacher plan, teach, and assess all of the students in the classroom. They capitalize on strengths and skill sets of the SLP and the teacher and kind of play on both of those. And then the teaching partners alternate between serving as a lead and providing support. So that one you have to be pretty involved and have a lot of trust with that teacher to do. And then there is supplemental teaching where one person, and that's usually the teacher, presents a lesson in a standard format while the other person, which is usually the SLP, adapts the lesson. So those are kind of all of them in a nutshell.
Wow, that's great. I think some of us out there are going, oh my gosh, you know what? I've done that, but I didn't know it was labeled something. Yeah.
Yeah.
Thank you for sharing that, right? Okay. What are some examples of using a classroom support model while in various subjects?
Yeah. So I sometimes divide them by subjects and sometimes divide them as grades. Like most of the time when I'm using the specific models, it depends on the students and the grade levels or the classroom itself. So if I'm using station teaching, I like to do that a lot if they're doing any sort of like kind of follow up to reading activity, or if they have stations in the classroom, I go in during that time. I really like to do it during literacy activities because if I'm bringing my own station materials, I usually have a lot of them. So usually I have something that'll work for that lesson. And it ends up being really nice, especially with those little ones, because they're used to already hopping around to the different sections of the classroom. So it feels very naturalistic for them to just integrate that into their day. And also it's really great to kind of screen the students in the classroom kind of when you're going into like a younger, like transitional kindergarten or preschool classroom. You're introduced to all the students. So the ones that might just like slip under the radar where like the teacher's like, I'm not sure, they're probably fine. Like if it's stuttering and the teacher isn't familiar with that, or maybe they have some language delays that you just need to provide a little bit of a boost. It's a very easy way to do those things. So I really like to use that because I get a little bit of a bigger picture of that whole class with a bit more of a individualized touch. But I also like to use the co-teaching approach. So that one again is when you're partnering together during whole group instruction. So maybe if I'm doing like phonological awareness, I'll have like the Mighty Mouth out and be modeling with that, or like different cue cards. I love the B-Worm speech cards. I use those all the time. So I may have those out. But there's also a lot of different models I use with my alternate curriculum classrooms. I use the supportive co-teaching with alternate curriculum as well, where I'm helping that teacher working side by side by providing cues. Usually that has to do with modeling AAC. And I also like to come in and do parallel co-teaching. So that would be when you're modifying materials a little bit for a group and you're giving slower pacing or just modifying that content for them. And I do that with upper elementary a lot because those students tend to need support. But that would be a lot of the times. I do it with math. I'll do it with science. You can really do it with anything. But the best way to start is kind of think about your speech therapy and how you do speech therapy. Like if you do lots of crafts, maybe come in during art and integrate it during art. And then you don't have to prep everything when you have like a million different materials. So it really is just integrating it. It's not necessarily like, okay, they're doing math. It's using your skills as a speech therapist to help support and lead those curricular activities.
I get that really, to me, that opens up the times that you can go in and see the students. Because a lot of times in the school setting, we have just limited time, you know, if we're pulling out like that direct service. So actually turning our thoughts around and really looking at how can we better suit it by going in and doing classroom based, you could go in at any subject.
Yeah, I even when I started, a lot of SLPs were like, "Oh, don't observe during math. Don't do stuff during math because it's all numbers." And like all my upper elementary kids are like, "But I don't understand the word problems. Like I don't understand when Johnny has 5 apples and Susie has 3. How many do they have when they're together?" Like the unpacking the language with the mathematics skills is just like really challenging for them. So being there to help support them during those times is a way for them to generalize their speech and language skills that we're working on. And it also helps them access that curricular material that is more challenging than it really should be for them because they already have challenges to begin with.
Absolutely. And think about all the vocabulary in math. I mean, there's a
Mm-hmm.
ton of math vocabulary specific to that, or even in science too. I mean, those would be other great times to go in.
Science is awesome. It's so fun because you can talk about like a lot of diverse subjects. So you can talk about animals, you can talk about volcanoes, you can talk about like anything, the ocean. So there's lots of diverse things you can talk about, but then it's also really fun when you get to go in during an experiment and like they have manipulatives and you can provide support during those. And it's really engaging for those students. They're excited to like work with you at those times because the material can be really entertaining and exciting for them.
I love it. I love it. I mean, I'm hearing a lot of advantages here, people, but hey, are there any challenges that you find when integrating service delivery this way?
There are some challenges. I'd say the biggest one is getting teachers on board. So I don't want to go too heavy into that because that's a lot of there's a lot of layers to kind of work with there because every teacher is different.
Mhm.
But some of the ones that I try and think about, like that people would bring up to me as cons, I try and think of ways to resolve them. So, like, one of them is possibly fewer opportunities for specific and individualized feedback, which if they are going from a direct session, like either individualized or in like a 2 to 3 person group, there are going to be fewer opportunities for you to give specific feedback. So some options for that are providing alternate supports like visuals or self-rating charts or practice sheets targeting the speech and language goals for them to indicate whether they did well or had difficulty or how they just felt about the activity overall. And it's really helpful for students because they're able to assess the skills for themselves and reflect on them. So that increases generalization of their skills because they understand, oh, okay, like that was really hard. And sometimes it's like, oh, that was really hard, but that's okay. I know what I can do, or that was really hard. I need to go talk to Miss Tiffany about it, or I'll just see it on the chart and be like, okay, let's unpack why that was hard and try and give you some tools to help make that a little bit more attainable and easier for you and less frustrating because you don't want them to get frustrated. So that's a big one. There's definitely more. There's classroom distraction, which is a little bit harder to navigate because you don't know what you're going into. It's not like you get a sheet of every single student when you get into the room on who makes a lot of jokes or is a little bit more rambunctious or loud. So I tend to use that as an opportunity to help my students focus a little more because there will always be distractions if they're at work, if they're like if they get older, if they're at work, if they're in high school, middle school, it doesn't matter if they're at home trying to do homework, like they're going to have distractions. So giving them coping mechanisms is really helpful, or just the ability to help them learn to redirect themselves to maintain their attention to the task. And it's already in a setting where those behaviors are being seen naturally. So it's not like bringing them to speech takes it away. It just takes it away for a half an hour.
Right. And then they're expected to do it in a distractible environment. So
Yes.
yeah, so you're kind of killing two birds with one stone, so to speak, because you're having them practice in the setting that they're going to be needing to use it.
Yes, it does make sometimes it makes the progress go a little slower because you're working on multiple things, but
Sure.
then it works so it goes a little faster because they're generalizing easier because generalizing can be such a hard thing to get to after they've already attained it. Like you're like, oh, well, they're able to do it in speech, but then they don't do it once they get to class, or they don't do it with any other person. They see you and they're able to do this, but they're not able to carry it over. So it already takes away that hurdle. So even though it might be a little harder at first, it really pays off in the end with the generalization.
You are turning these challenges into advantages. I love it. Oh, I didn't mean to stop. I didn't mean to stop you. Keep going.
You're good. The last one would probably be scheduling challenges, and that's really teacher dependent. I find it's not typically based on me. If you're just getting started, again, going on times you're more comfortable. If you do a lot of crafts at speech, maybe going during art. If you do a lot of literacy activities during speech, maybe going during that time since you're already comfortable using that skill set. Or if you're comfortable doing like station teaching, that's a really easy way for you to bring your own stuff and go in. Although I do really like to use the teacher's materials because that's less work for me in the long run. And it's also more curricular based because even though I have supports and tools to help my students for speech and language in my classroom, it's not, I can't like off the top of my head tell you the vocabulary that they work on in second grade in September. Like I don't know. Like I find out when I show up.
Exactly. Yeah.
So scheduling can be tricky, but usually it can be, it gets like easier with time. The hardest thing for me is when I have lots of students in different classrooms. Like if it's like one student in one classroom and that's the only student in that class, that's when it's hard for me to schedule.
Sure.
So sometimes I can try that during extracurriculars if they have classes combined or something like that.
Mm-hmm. Cool. I want to kind of touch back onto teachers because I think everything that you're doing is fabulous and amazing. And I know our listeners are like, yes, help us that maybe we haven't been doing this type of push-in service delivery model. How do we get the teachers on board?
So teachers can be really, really excited to work with you or really, really resistant to work with you or somewhere in the middle, or really you get all the ranges when you're in the schools. But the first thing I like to do with a lot of the teachers I work with is have them understand our job responsibilities and what the student needs are. So I really like to pare back and begin with the basics. So I talk about like all of our different roles. Like we have to work on prevention, assessment, intervention, and try to provide appropriate services across that whole spectrum and across, voice and AAC and like articulation and stuttering and language and, the whole spectrum of our job. I try and unpack that a little bit. And I try to talk to them about how I also have to collaborate with the families and make sure that we're communicating with them all the time. Again, that's easier in the support in like a co-teaching model because the teachers help you communicate with those families as well. So that does make it a little easier. But I try and kind of unpack what our role is and then also talk about academic impact. A lot of my students some of them tend to be distracting in the classroom. So
Sure.
sometimes those teachers are really excited for that student to leave for 30 minutes to an hour to go to speech. So talking about the impact of academics can be like a really big thing when they're excited to have a little bit of time for them to focus away from a distraction. But, that's only putting a Band-Aid on it. It doesn't really help. But I try to really unpack that to start.
What I love is what I'm hearing is a lot of advocacy of our profession. And I like the word you're using with educational impact or academic impact, either way. And then, yes, it would be, I know I was a teacher before I became a speech path. So yeah, of course it's fun. It's nice to have a little breather, but is that really, well, we're not here for the teacher. We're here for the student, and I mean, so I get it that the teacher might be like, no, I'd rather you take him out, but you're saying, but that's not what we're here for. We're here for him to stay. And he's not accessing his academics if I'm taking him out.
Yeah.
Right? Yeah. Yeah.
Yeah. And I think a big thing too that a lot of people don't think about when you're collaborating with the teachers is that you also should collaborate with like the paraeducators and the paraprofessionals because they can play such a big role in like helping you connect with students, helping support those students, making sure that you're connecting with the whole school staff in the classroom, including them in those conversations can be really helpful to start. just because a lot of the time the para educators are who is supporting your student when they're getting distracted, getting frustrated, having trouble explaining something. They're usually the ones that are navigating that. The teacher is leading a whole group, like a whole group like lesson. So that's also a really big thing. I like to emphasize that, to include those paraprofessionals, those paraeducators. They're very vital.
Absolutely, right? Because yeah, us coming in isn't a break for anybody. It's actually we're going in to enhance what they're doing. We're not here to give them a break. Yeah, I like
Yep.
it. And I do know that working with those paraeducators, the ones that I work with, they're amazing. They know those students, and I rely on them a lot to give me the information I need. And they, I guess when you feel the ownership, you just get the fidelity of the application of what you're asking them to do. Yeah, that's wonderful. All right. So we've got teachers on board because we've advocated for our profession, told them what we're here to do and why we're doing it. We've got our paraeducators on board. Where do we go now?
So if they're on board with us coming in, we want to make sure that we are trying to figure out the best way to support these kids. And a lot of that is understanding their needs. So you want to impact the disorder, the goals that you're working on. So a lot of the times I try and think about making sure what supports I'm giving, what supports I don't want to give with those students. So like, and when I'm educating the classroom. So I always try not to provide really specific terms for every component. We get in like kind of a rhythm of using like aided language stimulation and alveolar ridge and like milieu therapy. And that can be really overwhelming when you're starting off. It's great to build that in and kind of get them to understand it a little more and peppering it in, but giving them additional meanings. So saying like, oh, aided language stimulation, but it's also called modeling. Or alveolar ridge, or like that little bump behind your teeth. Or saying like milieu therapy. So we're going to structure the environment. We're going to collaborate. We're going to make sure we're giving feedback, all those things. Labeling exactly what it is, giving them that overarching label is great, but they're not going to take that away and know exactly how to use it. But if you're explaining it in a little bit more of layman's terms, it can be a lot more helpful for them to like apply that when they're working with the student. I also like to provide lots of handouts. I do that a ton with stuttering. I do lots of handouts for stuttering, and I also provide visuals for articulation support for my students as well. A lot of them are like mouth cues or like different prompts that we use. Like if I have a student with a lisp, I'll talk like, especially a lateral lisp, I talk about like a flat tire sound and like that, or the T to S transition. We'll talk about that. And I try to give them cues on that so that they know how to help that student. I also try and connect the disorder to what the teacher sees during the day. So instead of saying like, oh, this student is able to answer, they're having a lot of trouble answering why questions, I might be like, oh, well, they can't explain what happened at recess because they have a lot of trouble answering why questions in general. So, if they're upset after recess, it's really hard when you ask them like, why are you upset? Like maybe unpack that and try and give them support. Like, did something happen at recess? Ask more open-ended questions to try and like pair back and help them navigate those discussions better. So I try and apply it to what they see during the day, or things that I know are very noticeable that the student does during the day, to help them apply how this can be really helpful for those teachers, and also how they can use it intermittently instead of just when I'm there.
I love it. You're not only a great model for the student and getting with your target, but you're modeling for the supports, the teacher and the support staff, so that it will continue. Hopefully, when they understand the why we're doing something, then I think they're going to be like, yeah, absolutely. I think you would see a lot more support and carryover. I'm starting to say more positive outcomes when they're getting the same support throughout the day, not just that 30 minutes little segment with you. Yeah.
Yeah. And giving them those questions of like, that's why I always say with AEC, I'm like, build it into routines. It's easier with routines. You do them every day. Like, so that's the same thing with those students, right? If you build them into like, oh, this is what happens at school, that you see like at least a few times a week, you can apply it then. That's giving them those tools and like, oh, I can apply this then. I'll just use that then. And then eventually, hopefully, it gets built into more throughout the day. But, to start, it's a really good place to go because it can be really overwhelming because we know teachers have a lot to do. They have a lot on their plate.
They do. And so how do you, because teachers really, I mean, they are shouldering huge responsibilities. How do you go about establishing communication with teachers about the students' progress or?
Yeah, there's lots of different systems that I've used. I've done email check-ins with teachers. It depends on how often I'm at a site. I had 1 year where I was assigned to the site 1 day a week, and that can be really challenging to like see all your students, assess all the students, screen any students, then like go see the teachers. Even if your caseload's a little smaller in that case, it still is a lot to do in 1 day. So I've done email check-ins, and sometimes I just like schedule them in advance on Outlook where I'm like, okay, I know I need a check-in at this day, and I just like have it scheduled because I'll forget later. And then I'm like, oh, it popped in my inbox. So that's nice. But also you can do like a morning coffee hour. I usually like will leave my door open and let them come in to my room whenever. But like if you're new to a site, maybe like establishing that with some of your teachers and saying, like, oh, I'm gonna have a coffee hour on this day. Like if you want to come in, we can have coffee together and just talk about it. You can do open door office hours. I schedule discussions with my teachers a lot of the time because usually it's something that comes up randomly during like a support session. I'm like, oh, okay, like this happened and it was a little weirder. This happened and it was really great. And usually I'll pop in or like when I'm leaving, I'll be like, can I come back another time to talk to you? And then they just tell me when to come in and I'll pop in and talk to them then. But you can also do like written communication. So you can have like a communication binder. We use that all the time with like parents. So we can use it with teachers too. So like having a little communication binder before you leave, jot down what you need to say. And you don't have to worry about coming back. And the teacher has everything down and they have a space that they can write down any questions they have. You can also use that and do a goal tracker within the classroom that you and the teacher could record data in, which could really help as well. It'll help with your notes too. If you're like, oh, I forgot a note, I can like run and do that really quick. I forgot to grab my data or I can't remember.
That's great. Those are great tips. Thank you so much for sharing. I love it. Where do we want to go next?
Well, I think a big thing that I always try to emphasize is like, I always say like, you want to build rapport with your students. You want to build rapport with your teachers in your school site. When I got to my school site, I've been at the same school since I started with LAUSD. When I got there, they really were not super thrilled with speech. They were very strict on like, hey, this is the time you need to see him. Or sometimes I got like, well, speech doesn't do much. And I'm like, okay, that's fine. Like we're going to navigate this. I love my school. There's a great staff. My teachers are so great about advocating for their students and they really try to make sure that we're providing the least academic impact. So a big thing was like learning how to establish rapport with them. So building a relationship. When I had the teachers who were like, I've been doing this for so long and like, I disagree with it. I'm like, okay, like, so what do you do? I try to like unpack like, what's going on with it? Like, what is your interpretation then? If you disagree with it, like, what are you seeing that I'm not seeing? Or what in your experience has happened? Have you tried these different things? Because sometimes it just comes from like them not being educated on things that we are up to date on, but maybe they weren't educated about by past providers, or maybe their school was uncovered and they did not like have anyone for a while. And yeah, they need a bit more of a re-education. And sometimes it's also just, they could be like super overwhelmed when you come in and they could be just like, they have bad days too. And just be like, okay, they just need a day, like give them a day. Also, teachers are particular too. Like they don't like schedule changes sometimes. Sometimes they're like, do whatever, but sometimes they really don't like schedule changes. So like making sure that you try to be really cognizant of that. I know that I tried to do that. And then like eventually I'm a little bit more relaxed now that I've been there for a while and the teachers are more flexible with me because I was really good about it to start with like, okay, I need to change the schedule today. I have an IEP. Like, is there a time that I can come in or do you want me to alter the day? Or is there something I can do to make this easier on you? And I did that for like a couple years, and now it's a little bit easier where I can just be like, okay, I can like come in now. Like, is this okay? But it took a little bit. So sometimes just like making sure we're establishing that trust and rapport that we always emphasize on our students with those teachers as well, because having that relationship with them can really help make your job easier, make the students' day easier, make every aspect easier. So that's a big thing I always emphasize. Like, you want to establish rapport. We always say it with kids. We want to do it with our team members too.
I love it. Yeah, that's insightful. And also for, there's always that teacher that says he hasn't been seen in speech or he's never gone to speech. And then but if you're in the classroom, I'm here. Of course
Yeah.
that kind of takes away that, because I know that's been brought up with other SLPs saying, come on now. But yeah, I think start building relationships is kind of our jam as speech pathologists. We're communicators, and just communicating with the teachers as we would. I love how you say we set up the expectations and the rapport with the students. Why wouldn't we do that with the teachers? I mean, it just makes sense. And you're right. Sometimes when we front load, I guess is what it's called. Sorry, front load, maybe with doing, like you said, if you're new to the campus or you're a new SLP full stop, starting slow and kind of finding your position in the school rather than going full, gangbusters and saying, this is how I'm going to do it, but kind of listening to your teachers and influence the teachers by saying the benefit of me coming in and what I will be doing. Not manipulate. I like the word influence, that to get us all on the same page. I like that. Do you want to get into what about maybe some disagreements if you have a teacher that kind of disagrees with what you're doing?
Yeah. So the big thing I always look at is, again, like kind of what I said before, is figuring out the whys. So like, what is their reason for disagreeing on this? Like, do they have past experience with an SLP on a personal level that, like, maybe it was their child's SLP or a niece or nephew or like their parents' SLP that they didn't agree with maybe a similar therapy technique that I'm using and they didn't feel like it was effective? Like, we don't always know why they are saying no. So I always want to try and look at those components. And then if they continue to say no, usually I like to make sure I'm providing lots of data and handouts. I also provide a lot of EBP. Like, I've been known to have like a question and be like, oh, I have a research article. Here's the summary, but like also here it is if you want to read it. Like, it's right there and it's cited and it's peer reviewed and it's not biased from me. So you can read that. So I also try to make sure I'm providing EBP for them and resources that are outside of just like what I'm saying, because especially in the world today where, like, we have Instagram influencers saying all these things that could or could not be true. And we have blogs that are all over the place that, like, some of them cite research, some of them don't. And it can be the same thing with those parents, or YouTube too. YouTube can be really tough. So, or those teachers. So you want to make sure that you're providing those resources, because there are so many people who will say, like, I'm an expert on this. And yet you'll look at it, and if you are an expert in that area, or if you are a speech pathologist that has a really great knowledge and background on EBP, like hopefully all of us are, then you're like, are you sure? Is that actually the correct way that we should be doing things at this time, or has there been more recent data? And maybe you aren't aware of that recent data. So it's always good to investigate, because maybe it's something that you weren't aware of that they were informed on. But most of the time, I always just try and start providing rationale for all my actions so that they know why I'm doing things, but I also want to know why they're disagreeing so that I can help them understand why I'm doing things or why I'm recommending this, or work with them on maybe something that would be more palatable for them to start and build them up. So like for AAC, if they're really frustrated with, like, grid size is obviously like a huge debate with teachers. They get really overwhelmed by a big size of a communication board. So maybe I'm like, okay, we're going to like hide a few icons if your students are overwhelmed. But if you're overwhelmed, then you can practice hiding a few icons on the one on your desk, and we'll leave the one up for the students. And we provide like just kind of, bite-sized advice to help them modify the content so that it's easier for them to unpack if they continue to be frustrated. So it really does depend on the teacher and the student and the reason that they're frustrated and they're disagreeing with you. Because it could also just be, I don't want you in my classroom.
Yeah, right. And I love that. Yeah, I liked your bite-sized kind of spoon feed little bites until it becomes palatable. Maybe you need to try it a few times before you decide you don't like it.
Yeah,
That's a great
exactly. Yeah,
yeah, sorry, go ahead.
no, I know it can be really overwhelming because like I know like I have areas in speech that I'm not an expert on and that I don't treat super often. And usually when I get one of those students, I'm like, okay, well, I need to set aside time to like double check my EVP, double check that I'm following the most recent like therapy recommendations, like stuttering for when I try really hard to access resources and be really careful about how I'm treating it so that I'm appropriately supporting my students, because it's not my area of expertise, but people come to me for AAC for that. So it's I understand that it can be overwhelming, but that's why, you want to give up a little bit of bite-sized advice. It can be helpful for them to understand it a little better.
Fantastic. Okay, what haven't we touched on? I think we've gone through the types of service delivery. I tried to write them down so I'd remember them all, but there were the 6 of them, and I know that we're doing them, but we didn't, give us credit that we're actually doing, I'm actually doing the zones. I'm doing supportive co-teaching. I love that, giving us, and for those of us that maybe some of this is new, that's a great idea, or a new way of looking at a push-in model. If you haven't done the centers or stations, that is fun. I love that.
Yeah, it's also a great tool to use when a teacher isn't agreeing with you about coming into their classroom. You can say like, I have 6 different ways I can come in. Let's talk about them, and we can decide as a team which one you think best fits your classroom. And
giving her the choice. So she or he, they, giving them the power, I guess, or the choice, gives it back to them so they feel like, because that's their classroom. They have a lot of ownership. And that's a way of honoring, hey, yes, I know I'm coming into your space. So tell me how you'd like me to come. I'm coming into your space. So tell me how you'd like me to come into your space.
yes, this is happening. Let's figure out a way for it to work.
Right. Buckle up, ladies. Here we go. But you can, but I know I'm being tongue in cheeky, but just giving them that little bit really can kind of de-escalate the fear of, because I don't know what you're going to be doing. And then really explaining how and what you'll be doing. Again, that pre-teach that teachers do with every subject when they have a new subject coming in, they're pre-teaching, to their students. We're kind of doing the same model actually for them. So yeah, I love that. Yeah.
Yeah. And it also gives them some like say and power if you're giving them options on like, I can come in during a lesson. What subject do you want me to come in on? And being flexible on their terms can really make them feel more open to you coming in, because you're saying like, I'm going to come in, but I want you to feel comfortable with it. And like, is there a time or a model that will make you feel a little bit more empowered and on board with this as a team member? Because you're equal parts of the team. It's not that you're taking over their classroom. You are co-teaching. You are doing integrated therapy support. You're not there to fill their shoes. You're there to help build up their toolbox.
That's wonderful. That's a great, I love that. There was another advantage you said earlier today, and I kind of wanted to revisit it, because when you were talking about, especially when you're going into a classroom, maybe in early education or one of the, the young grades, and you're getting to work with the whole class, because I know a lot of states were not permitted to do a screening. Some states are, I think, but I know in mine we are not. But if you are doing a classroom push-in, a classroom integrated service delivery model, you do, just by default, you're going to be working with all sorts of children and being able to write. I'm not going to use the word screen, but just sort of be prepared and see what is going on in the classroom. But then what I loved is when you were talking about the modeling and the supports that you're giving to the students that are identified is just good modeling and supports for all the students.
Yep. Yeah, it's really nice because with this screening, or like my state allows screenings, so we do screenings. But so if we're doing screenings, for me, it helps identify students more accurately. And it also helps decrease how many screenings I'm doing. Because sometimes I'll come in and I'll get like, 15 screening requests the first month of school.
Wow.
And like that's a lot of work. That's a full day. Like that is at least a full day. But if you're already screening, and most of the time they come from the little ones classroom.
Right.
So if you're already doing the integrated support model, then you are already seeing those students. And so you can be like, we're gonna give them, the integrated support we're already providing. And let's watch and we'll see how they're doing in like a couple months when they're a little more used to school. Or maybe you're like, oh no, that one really does need some gridded service, and we need to make sure we're tracking everything, and they're going to be seeing someone for a bit. Or maybe it's like they're fine, they're doing things that kids do, and maybe you haven't seen it as much, but it's okay that they're not able to pronounce the R sound when they're 4. Like it's all right.
Right. And I like that because our littles that are coming in, they haven't been in the school setting, and we don't know where they are coming from, if they weren't in daycare or they weren't, if they were home alone with grandma, is a different scenario than maybe they're coming from a educational based preschool. They're coming from different walks of life, and right, sometimes giving them the gift of time, acclimate to what the expectations for school because we don't want to over identify,
Yeah. And the other thing in my school district, we have a lot of like dual language learners. So a lot of our students, their primary language isn't English. So sometimes it's really overwhelming when they come into school and they're bombarded by English when they've only heard Spanish at home, or they've only heard Vietnamese or something like that. So we have a pretty diverse range of students that come into our schools. So it's also good to like know that, or they're just hard to understand because they have dialectal differences, and explaining that to the teacher because you're able to see that a little bit more closely. So it can be really helpful in that way as well, rather than just the benefit for your student. It can help that class as a whole. And there are other classrooms that helps as well. If they have students who are challenged with like focus, providing those visual aids are helpful for most students, not just our students that we see or that have needs. Visual aids are great for everyone.
Right. We always say, yes, speech would benefit everyone. Everyone would benefit from speech. That's great. But, we have to be servicing just the ones that require the speech services. However, it's good teaching's good teaching. Good strategies are good strategies. And being able to have that carry over into the classroom for those students that are struggling, but aren't struggling enough that they need, individualized supports.
Yeah. It's really important to be able to discern that. And then also you showing that in the classroom will help the teachers be able to understand why or why not you're recommending services for this student versus that student. It can really help them understand it. So when you go into the IEPs, they're more on board with what you're recommending, or in the cases of your students as well, you're more aligned on what goals are important. So it also helps with IEPs a lot because you already have that baseline communication with teachers, rather than going into an IEP where it can be combative with other professionals. I know that some people face that in their IEPs. I've been very fortunate and haven't, but I also spent a lot of time building rapport with my teachers and getting them communicate with me and talk to me if they have concerns or if they have worries, or like even something as simple as like if they have a screening request that didn't get done, talking to them about why it's not done a week before the end of the school year when they submitted it on the Monday before we're gone.
Right. And I think Another benefit, it would probably reduce the amount of screenings because the teachers are seeing you, you're there, you're talking to them about, they're seeing what you're doing, and then you're able to educate them on why this is appropriate behavior or appropriate presenting, whatever they're doing is actually age appropriate or developmentally appropriate at the time. I think that's powerful for teachers to really understand, because I think sometimes when they just think, oh, the kids are out of my classroom, I'm going to start sending all of them to speech, so then they will all leave the classroom, when they don't really know what speech is. And just, I hate the term speech only. That's not really, I hate that, because that's not what we do. That, I mean, we do so much more than, speech sound. And then, sorry, that was a little bit of a platform I just jumped on. Sorry about that.
No, it's okay. I feel like a lot of teachers aren't like aware of those things. Like I remember my first student that I had with fluency concerns, like the teacher was like, "Oh, I didn't even know you did this." And I was like, "Yeah, it's in our scope." Like we should this, because she was like, "Oh, it's not a big deal. They just I noticed them stuttering. The parent was more concerned than I am." And I was like, "Okay, well, let me pop in. Let's hang out." That student in particular needed support, but the discussion with the teacher was, "I didn't know that you even did that." And I was like, "Oh, yep, it's our skill."
That just reminded me of your little coffee talks. Come in for coffee. Let's just talk about it. I love that. I love that.
Yeah. The less formal you make it, the better, I feel like, for teachers, because it already can be, and depending on your school culture, obviously every school is different, but it can be really formal at different school sites, and they expect I've been in schools where it can be almost like an uptight environment. So trying to get it to be more of a conversation rather than a interview or interrogation or anything like that. You know what I mean? Like we want them to feel like it's a conversation and you're approachable and they're ready to talk to you, rather than it being something that is kind of scary for them to contact you about or to collaborate with you, is something that's like another thing on their to-do list that they don't want to deal with. Like you never want to be that source of frustration for a teacher, because it just makes your life more challenging, and it's harder for your kids, your students. Like if that teacher doesn't want to like collaborate with you, it can be really challenging on the students, because it's harder to navigate service delivery, it's harder to generalize the supports. And the biggest thing is I don't want to make my students' life more challenging ever. Like I want to make it easier and better for them.
Right. We're here to help, not to hinder. We are supposed to be value add, right?
Yeah.
I mean, and really, basically you're getting into advocating for students.
Yeah. Yeah. I always try and remember, especially when I was newer, I haven't been practicing like a super, super long time. Like I've been practicing this is my I'm in like the middle of my 4th year. So I've been working in the schools for, I want to say like 10 years. It's been a long time, but so it's very, it made me really nervous when I started to like advocate for students, because, you feel like you're newer and you're younger and you aren't prepared to go and talk to a teacher with 15 years of experience that is not on board with what you have to say. But, at the end of the day, I'm there to support my students, and I need to advocate in the best way possible to make sure that they're getting the support they need and they're progressing towards their skills as quickly as we can get them to, and make sure that we're not impacting their academics as much as possible, because like that's what I'm here for. I'm here to advocate, make sure that they're okay. So it's important. It's such a big, important part of our job, especially when you're working as a multidisciplinary team.
Absolutely. When you go back, I think the buzzword right now is educational impact, those impact statements. And you touched on that for us, and I really appreciate that. And that when we think about impact, we want to be a positive impact rather than a negative impact, so we're wanting, yeah.
Yeah. If we're taking them out all the time and they're missing class for 90 minutes a week or 60 minutes a week, whatever it is, they're still missing class. So the less that we can create that impact, the better for those students, because it's just so important that they receive that support and they receive it in a way that they're able to still attend their classroom sessions and attend their lessons. And I know that there are like parents who demand like individualized services or small group based therapy. And those are always like discussions that you want to navigate, but there are so many research articles and just like evidence that you can cite that shows that this is like the most beneficial way to treat the students. And I always try and go back to that when I talk to parents, because sometimes it's just they're trying to advocate for their kids for the best way that they know how. So, you know, if you're providing tools showing that you are too, sometimes that can really
Right.
help.
Right. Rather than getting mad that the parent is asking for individual session, or I know I want them to be pulled out, because maybe in their mind they think because that's what maybe they had some private therapy and that's what they're used to and that's what they want to have in the schools. But again, part of our job is to educate not only our staff and the students, but also the parents, to educate them what really is the role of a school-based speech pathologist.
Mm-hmm.
Right. And it is access education. It's for the student to be accessing their education. So, I mean, I do agree. Some students do need, and at some point might need that pull out model or that individual to work on a skill or what have you. But the expectation is to be in school, to be in their classroom, to be with their peers, to be educated. And we're here to support that for them to be accessing their education. I think that's important for parents to, when they understand the difference. And I don't like it. I'm not saying that we're different than any other setting. No, we have the same credentials. We have the same abilities and everything, but our goal is slightly different.
Yeah, I think it's also there's different like benefits to each thing. I've worked in private practice before, and I think I always tell the parents like some really great things about the schools, that it's a naturalistic environment, so it's easier for students to generalize the things that they're taught in their speech like sessions or when they're working with a speech pathologist. But also the other thing is like their peers are present. Like I've worked in private practices where parents have requested group sessions and you just can't arrange it because schedules don't work. And so this is something that's available in the schools already, where you can provide that support while their peers are there, which is helpful for those students to generalize. Like if you're working on social skills, that can be really, really helpful to have that student be able to navigate a conversation and appropriately alter the topic if they need to something that's more engaging for them. That's really empowering for them. It gets them excited to talk to other students. Like it can really help just either generalize those goals or get the student excited about those goals. And then that also helps them make friends. And everyone loves it when their students make friends.
Right? Exactly.
Or when their kids do.
I know. That really is so important, especially with pragmatics, our kids that are struggling with their social competence. Pulling them out and having them work with you is not authentic or natural. And creating a scenario is not the same as being in the scenario and having to navigate a real life scenario, rather than trying to, okay, let's imagine that you are blah, blah, blah. Instead of, okay, we're in the classroom, this just happened. What should we do? What are we thinking? What should we say? Is that a think it? Or is that a say it?
Yeah, and it also helps the students who go into like any sort of crisis or get really frustrated and may have like any self-injurious behaviors or anything like that. Because if you're able to be in the classroom and support when they're having a frustrating moment or something that could escalate, you can be there to provide those tools of like, oh, okay, so do we need some alternate seating options? Do we need a second to have some sensory input? Do we just need a second in general? What can we do to like help us navigate that? So it can also provide that support where the teacher can see what's effective to help those students when they're having those frustrating moments. And it also helps that student learn that I can use these tools when I'm in class, and it will help me attend my classroom lessons a little bit better because I'm able to access these independently. I know that like for me, I really emphasize like alternate seating options because I'm like, sometimes they don't want to be right next to everyone and it's a little bit overwhelming. So like having them have the option to like I've had a student where I'm like, okay, you have to have your hand on this table, but you can walk around this table but like you have to have your hand on the table because otherwise he'd be all around the classroom. So I was like, okay, hand on the table, but you can walk around or you can sit in this chair away from the students or you can sit on the carpet with the students, whatever you want, but you've got to pick one of those. So giving them the autonomy to meet their needs does help them. And that student now, like I've had him for a few years and now he's able to like just sit in class. Like he's fine. He does not need alternate seating. He does not need to stand. But like when he was younger, it was a huge challenge in the classroom. And it was a huge challenge anytime I came in, anytime I talked to the teacher, it was a big area of concern. And even though it's not speech skills, it does help with his attending to speech sessions and to his classroom sessions. And it's something that I knew how to navigate that I could help him with.
Wow, I love that. And I think, again, we're going back to giving everyone autonomy, giving everybody choices for themselves, and for children to know that there are choices when you're in that crisis or having whatever. It might not be a full crisis, but you're having a moment of frustration or and you feel out of control, giving them back some control to help them get. Yeah, I like that.
Yeah, I'm all about them having autonomy and at least a bit of control. I know like as a parent, I'm also like boundaries are great, but also I want to make sure that they have the ability to like express their opinions and have some control over their environment. If they have something that's overwhelming, like we can make it easier for them, they can still access the content. Like that's the most accessible version of how we can help them attain their educational goals and their speech and language goals.
I love it because there's usually more than one way to get to where we need to go or do a particular activity. And sometimes giving, it's hard for speech paths, it's hard for teachers to give up some control. But I think it was important when you're saying, yes, we have boundaries, but within those boundaries, there are choices. And when you give choices that you are both willing to accept, like don't give a choice that you're not okay with. Right? So I love that. You can walk around the table, put your hand on the table. I love that example. Or when you said, give them 3 choices of seating. Do you want to sit? I can't remember what you said, but I think it was like, do you want to sit with your peers? Do you want to sit away from your peers? Do you want to sit in a different seat altogether? It gets them thinking, stop whatever is happening. Oh, wait, I've got choice. What do I want? Yeah, I want to sit on my peer. That wasn't a choice, sir. That wasn't a choice today.
Well, sometimes they do that anyway, and you're like, that's not our choice, buddy.
Right.
Sometimes they think a little bit more out of the box than you expect.
I know, right? You're just like, wait a minute, where did that come from? Yeah, I know. I think we could all write a book on things kids say and do that shock us every day. Something new every day. Something's going to happen.
Yep.
Oh my gosh, Tiffany, I think we're getting close to the end of our time. I can't believe it. Is there anything that we haven't touched on that you wanted to share with us?
I think we covered everything. I just really want to emphasize that it can be challenging to start like integrated classroom support, but like, just remember that you're the best advocate for your students. There's lots of research behind it to support that model of support. So you can make sure to cite those. I know that there's references in this podcast resource. So the references provided outline those. So you can just hand them that sheet if you want. But also just make sure that you are feeling empowered to work with those teachers and make sure that you're making a system of support within your school and, laying some groundwork for that. And part of that is an integrated therapy model.
Love it. I love it. I have learned so much from you today. I love this. Thank you, Tiffany, for joining us. I hope that you'll be willing to come back again. This has been so insightful and I love it. I think you just shared, I'm ready to go back and be like, oh, I want to try this model. I love it.
I'm so glad.
Yeah, no, it's fantastic. I hate to say it, but it is time to go. Thank you so much, Tiffany. Thank you. All right. See everybody later. Bye.
Bye.
Thanks for joining us on today's podcast. Remember to go to speechtherapypd.com to learn more about earning ASHA CEUs. We appreciate your positive reviews and support and would love for you to write a quick review and subscribe. If you have indicated that you are part of the ASHA registry and entered both your ASHA number and a complete address in your account profile prior to the course completion, we will submit earned CEUs to ASHA. Please allow 1 to 2 months from the completion date for your CEUs to be reflected on your ASHA transcript. For our School of Speech listeners, we have a special coupon code to receive $20 off any annual subscription to speechtherapypd.com. Head over there to get ASHA CEUs for listening to this podcast and all other episodes. The code is SCHOOL20. That is SCHOOL20. Hope to see you on our next episode. Also, please don't hesitate to tell us which topics you would like us to cover in future episodes. To get in touch, drop us a line in the comment section or send us a message on social media.